We have noted with great concern the tone of the post-cabinet briefing attended by the team from the Ministry of Health. We note that instead of addressing valid concerns raised not only by the People's National Party, but by well-thinking and independent-minded Jamaicans who have an issue with the healthcare sector's state, the team has instead opted to give us a masterclass in public relations. Instead of showing empathy for the victims of the public health sector, the mothers who are dying at an alarming rate, the neonates who have died at an increasing rate, what we are seeing is an episode of playing the victim by those who should be held to book.
The past week, and I'm reading, we have seen a sustained and coordinated set of attacks on our civil servants and volunteers in the public health system by the opposition party.
The People's National Party stands with the healthcare workers who are under-resourced and put under increasing pressure by the sicker and sicker number of patients seen in the public healthcare sector. The lack of resources is what we have a problem with, not the staff. To make it seem as if the People's National Party is attacking the healthcare workers is the use of tactical empathy. The news coming out of the healthcare sector is damning for a reason. It speaks to a system that is plagued by mismanagement, and instead of addressing these genuine concerns, people are being labeled as naysayers and mischief makers. It is unfortunate and it is devoid of a moral compass. But let us take a look at some of the issues. Instead of carpet bombing, we will do precision-guided rebuttals. Firstly, on the matter of the 3 deaths that have caused significant public furor.
Report on the death of Mr. Rohan Livingston Bryan at the Princess Margaret Hospital. The Southeast Regional Health Authority investigated the death of Mr. Rohan Livingston Bryan, who died on April 30th, 2024 at the Princess Margaret Hospital, 2 days after admission. Sarah's report identified several issues that may have contributed to the unfortunate outcome of Mr. Bryan. Investigations by Sarah are still ongoing. The case has also been referred to the patient complaints mechanism, where an expert panel of physicians and legal experts are being convened to review the issues raised in the report and to determine if there is any negligence on the part of any of the responsible personnel.
The outcome we can see from now is going to be to lay the blame on the staff, because already, if you note carefully, there is talk about negligence. Instead of equipping the workers, what we are going to see now is a blame game to see why it is that the system broke down. And with this talk of negligence, it is a cause for concern. The system that is broken was responsible in all cases for the transport of patients from one institution where the care was insufficient to another institution that was needed to give them the quality of care that would have given them a fighting chance at life. It is that system that must be addressed, and not to speak of possible negligence.
I understand from my sources that next week will come a new wave in that pictures are going to be circulated about the conditions in hospitals, some fabricated, others may be achieved in particular circumstances, to further give negative impression of hospital services. We will remain focused on the work we have to do and ignore the noise. And I call on all well-thinking Jamaican not to be gullible to these impressions and these purveyors of negativity.
There are no plans afoot to release pictures and videos exposing patient suffering to the public for political mileage. That is out of a playbook from another party. We would never stoop to that level because we know that using the suffering of Jamaicans, the distress of Jamaicans for political mileage will only come back to haunt you.
Has any doctor specializing in complex airway disorders, which would decrease the need for ventilators for infants, have any doctors been denied support for training in that area?
We do have limitations on the number of persons that go into DM training, but we've not had reason to deny any persons because of lack of space recently.
Yes, the answer is yes. At least one specialist was denied the opportunity to go off and study complex airway disease and treatment, a specialty that would have helped specifically pediatric patients requiring ventilation.
We presently have 43 ICU beds or ICU designated spaces. In addition, we have 23 high dependency areas that have been created. We would also have within our recovery rooms the capacity to be able to ventilate persons for very short periods until they are able to be moved to a high dependency or a intensive care unit.
The nurses and doctors at the Kingston Public Hospital, looking at the 5 functional ICU spaces in front of them, the nurses and doctors at the Cornwall Regional Hospital, looking at the only 2 functional ICU spaces in front of them this morning, are shaking their heads in disbelief. Disbelief because to say that you have 43 ICU spaces when you know that deep down you do not have the staff to operate them, the monitoring equipment, the ventilators that are working with the proper parts to fully operate those 43 spaces you claim that you have, is disingenuous at best. And it is unfair to the staff, because when relatives are asking why it is that their loved ones cannot get an ICU space, when you're telling them that there are only 5 at KPH or only 2 at Cornwall, when on TV and all over the media they're seeing that there are 43 spaces available, what position are you truly putting the staff in, the staff that you claim that you care so much about?
All of these spaces are potentially available. Not all of them are up and running. The running of a intensive care or high dependency space is highly dependent not just on the critical equipment but also critical staffing levels. Thank you.
The fact of the matter is that potential spaces does not equal a space that is functional. To use recovery room spaces in your count, which we specifically ask not be included in the count of ICU spaces, is disingenuous. And this is so because to use 22 recovery room spaces to ventilate patients and offer them critical care means that you would have to shut down the operating theaters, as no surgeries could be performed, as is the case when the recovery rooms are full.
Minister, the audit of the ventilators in the health sector did not state how many are assigned to NICU and pediatric units. So how many are assigned?
The ventilators that are available the numbers are going to change daily, okay? Because these equipment have to be checked on a daily basis and may come down for whatever reason, which may be a short term or may take a little while to get them back up. So we have, at this morning's check, we had 90 that were working, okay? Now, last week it might have been 100.
We need an honest assessment of the current situation. Last week, we were told that there were 118 functioning ventilators. Today, we're being told that there are 90, and according to the speaker, it may have been over 100 last week. The numbers continue to change. A change of 28 ventilators over the course of a few days does not speak to a system that is functional. We need the numbers of the ICU spaces that are functional, the numbers of the HDUs or high dependency units that are functional, and at the very least, the numbers of ventilators that are functional. We never asked if ventilators were stolen. To answer that question is disingenuous. To say that you have high dependency units that were retrofitted under the PROMAC program, when you know that the majority of these HDU spaces are not functional, is disingenuous. The country needs questions answered. If we ask questions, it is not being political. If the people of Jamaica ask questions, it is not being political. We are simply asking what is the status quo and what is the plan to improve on that status quo. These are the answers that we are demanding. We are not casting aspersions. We are not attacking the staff. We are defending the staff. We are speaking up for the staff, those who are afraid of victimization, those who are silently cheering us on, those who are sending the messages, the notes, to say finally, we have some people out there who are speaking out about what really obtains in the system because we can't. And this movement of Jamaicans allied with health workers who are fed up of the gimmicks and the PR, they are going to continue to speak out, whether or not we issue one more release.